This usually is filled with a lot of giggles and wrinkled noses all combined. So I would typically palpate the foot and ankle with the person in this position. So typically it's long sitting. Now, Ifani has a little bit of tight hamstrings. So for this person, I might actually have him go ahead and lie down because it's hard for him to sit all the way straight. For him, I thought it might be good for him to watch what I'm doing, so we suggested that he just kind of go back a little bit. But you do want to make sure your patient is comfortable. Just given the morphology of feet, I typically have them hang their feet over, okay, so that the feet are a little bit more relaxed. Right? So for me, the starting point is always the malleoli. Okay, the lateral malleolus is going to be inferior to the medial malleolus. The malleoli are going to be very important landmarks. The lateral malleolus we use in goniometry. We also have ligaments that are going to provide medial lateral stability that attach to the inferior malleoli, so that's also going to be important. Now, there is, if you look at the tibia and fibula together, down here they create an arch, and that arch is called the mortise. Okay, so if you might hear of what's called a high ankle sprain. That means the fascia between the distal tibia and fibula has been stretched or torn. Okay, and you might also hear of that as a mortise sprain. Right? I will use the word mortise. I want you to know what I'm talking about, and that's that arch between the tibia and fibula. On the tibia, you're going to want to be able to follow the anterior border up. When we talk about the popliteus manual muscle test, you will actually, one of the structures you can look at to see if they're rotating their tibia is this anterior border. I'm sure you've heard of shin splints. Some of you have experienced them. Typically, people will either have anterolateral shin splints or they will have posterior medial shin splints. And so we have the shaft of the tibia has that flat surface medially, so the anterior border of the tibia is going to be right along the top, and lateral to that is where the shin splints typically occur, so you need to be able to palpate that. The posterior medial border is just on the other side of that flat surface, and that's, again, in a muscle attachment site where you're going to have people have posterior medial shin splints. All right? Tibia, we have anterior border, medial border, the malleolus, the fibula, we just had the lateral malleolus. The trochlea of the talus is what's going to reside in that mortise. Okay? So if you slightly plantar flex the foot, the trochlea of the talus is going to pop out at you, and so you can palpate the talus there. All right? And then we've got, the big toe. So we're going to have the MTP joint here, okay? The sesamoid bones are going to reside right under the head of the first metatarsal, and so you can palpate those. Those are going to be right under the MTP joint. Then you're going to have your proximal phalanx and your distal phalanx, just like our thumb. There's going to be 2 joints there and then 3 joints in the rest of our toes. I think that covers everything on that slide. So should we stop, or are you guys still good? We'll keep going, right? So, apparently I like to do this because I'm looking and I'm just... Now, you're going to have not so much flexion of the big toe, okay, but you're going to have boatloads of extension. And if you have someone who has turf toe, which can be common in sports, particularly football, their toe is going to actually be stuck in extension. Okay, so they're going to have even less flexion. Yeah, it's pretty painful. All right, so we're going to palpate some of the tarsals now. The metatarsals are going to be in, obviously, in the foot, what I want to call the palm of the foot. The cuneiforms are going to be on the medial aspect, and they 1, 2, and 3. The metatarsals 1, 2, and 3 are going to articulate with the medial, middle, and lateral cuneiforms. Okay. So the best way to palpate the cuneiforms is to palpate the metatarsal and come back proximally, and then you will be on that tarsal bone. So you can do that for 1, then you can follow the second ray. That's going to be the middle cuneiform. The third, you're going to come off, and that's going to be the lateral cuneiform. toes 4 and 5 are going to come off and they're going to attach to the cuboid or articulate with the cuboid. Okay. Now the 5th metatarsal, the base is going to be rather pronounced because that's going to be a muscle attachment site. So to find the cuboid, it's going to be very handy to find that pronounced base and then come into that indentation, and then you'll know you're on the cuboid. All right? So let's stop there. So you're going to palpate the anterior border of the tibia, the medial border of the tibia, the malleoli. You're going to palpate the first metatarsal, the sesamoid bones, the proximal phalanx, the distal phalanx. You're going to come back and palpate the 3 cuneiforms, which are going to come off the metatarsals of digits 1, 2, and 3. The cuboid is going to come off of digits 4 and 5. The best way to find the cuboid, again, is to find the base of 5, and then come posterior to that into that indentation, and that's going to be the cuboid. All right, so let's go do that. Thank you.